Jim Kina. He is the general manager of Crown Group, which is an automotive supply company in downtown Detroit. And he is the author of a pro-liberty website called pathlessland.net. He's also the author of a book on Thomas Jefferson, and he is working right now on a book about President Obama. He has spoken at various events like the March for World Capitalism. And we proudly, at Rattle with Us, claim him as our own too. Please welcome Jim Kina.
Thank you, Mary Beth. You're much too kind. Fellow citizens, welcome to our healthcare tea party. Our purpose today is to share information about the proposed government takeover of healthcare. P.J. O'Rourke once said, "The Democrats are the party that says government will make you smarter, taller, richer, and remove the crabgrass from your lawn. The Republicans are the party that says government doesn't work, and then they get elected and prove it." That summarizes the dialogue in Washington today about this issue. Those in favor of the government takeover of healthcare argue that it will do unlikely things, like lower cost, improve care, and make the Detroit Lions Super Bowl champions.
Yeah.
Those opposed to it argue that such goals are unachievable because government is inherently inefficient and private citizens will make better choices in their own interest.
Called the market.
Let's begin with some high-level considerations of the government's proposal. There's a book called Lyndon Johnson and the Great Society. It describes the reasons for the failures of various government programs. The first reason can be summarized as, we didn't realize how much funding we really needed. The second reason can be summarized as, we had no idea how complex the problem really was. Those two reasons ring true when we examine various government programs. Let's face reality. Social Security is bankrupt. Medicare is bankrupt. The post office is bankrupt. Fannie Mae and Freddie Mac are bankrupt. Amtrak is bankrupt. In fact, the entire federal government would be classified as bankrupt if it was evaluated like a private business. Major sacrifices loom on the horizon for these existing programs, even before the government launches this new, expensive program. This suggests that allowing the government to take over healthcare, which represents 17% of our economy, is simply insane.